Hey everyone, welcome to Core Vet. So today in this particular session, we will be starting with the gram-positive bacteria. Okay, so in that, first of all, we are going to discuss about the Staphylococcus. So talking about the Staphylococcus, okay, so it is a non-spore forming bacteria. What does that mean? So means these particular bacteria aren't going to form spores in order to resist the harsh environment. Likewise, your Bacillus anthrax, they form the spores. Your Clostridium, they form the spores, right? But these particular Staphylococcus, they are not forming any spore to resist any harsh environment, right? So this is a gram positive, as I had mentioned. Now there is a two test, your catalase and the oxidase test, right? So for that, those tests, so it is a what? A catalase positive and oxidase negative test, right? So what are they? So let me discuss over here. So what happens? So what you can do in your bacteriological laboratory, see, take a bacterial culture, right? And in there, in your laboratory, there is a oxidase disc is there, right? So when you are going to just pour that culture on the oxidase disc, if it is going to turn into a purple dot, okay, within the 10-second of the span, then you can say that this particular culture is positive for the oxidase test. Okay, if it is not going to turn out purple within the 10-second of the span, then you can just state that this is an oxidase negative. Okay, this particular culture is oxidase negative, right? Now there is another test, which is the catalase test, in which we use the 3% hydrogen peroxide, right? In that, what we do, we just take a slide, okay, then we take a few drop of the 3% hydrogen peroxide, right? After that, what we do is that we just take an inoculation loop, okay, and take a loopful colony from the your petri dish, right? After taking the colony, we just mix the colony into the 3% of the hydrogen peroxide drop that we had taken on the slide, right? After, what we are going to do, when you are going to just mix that particular colony on the peroxide drop, what will happen? Then there are two possibilities, right? Either there is formation of bubble on that particular hydrogen peroxide drop after the mixing the culture with the hydrogen peroxide drop, or either it will just remain as normal drop that you had made, right? If the bubble are forming in that particular 3% H2O2 solution, okay, then you are going to state that this particular bacterial culture is positive for the catalase test, right? If it is not, then it is a negative for the catalase test, right? So this particular staph is what? It is catalase positive and oxidase negative. Now here comes a differentiating point between the strepto and the staph, that strepto, your streptococcus, okay, your strepto, right? It is what? It is both negative, means it is negative for catalase and negative for oxidase. So if you are going to have a differential diagnosis between the staph and the strepto, then you can just perform the catalase test, because the staphylococcus is going to show you a positive catalase test, while a what? Streptococcus is going to show you a negative catalase test, right? Now these are non-motile bacteria, right? And these have been named from the Greek word known as kokos, right? Which means what? A bunch of grapes or a bunch of berries, right? When you are going to stain from the gram staining, okay, after the gram staining, right? After the gram staining, there are two possibilities, right? Either the colonies will be what? Purple, right? Purple, or they will be reddish pink, right? They will be reddish pink or pink, right? So what happens if the colony is purple? It will show that it's a gram positive. It is what? Red, then reddish pink, then it will be what? Gram negative, right? Two possibilities are there after the gram staining, right? So if you're finding that there are purple colonies with what? With bunches, right? Likewise, these are the appearance. The bunches are there. Then you can just tentatively diagnose that, yeah, the infection could be of the Staphylococcus, right? And these bacteria are what? Facultative anaerobes, right? But there is a thing that there is a species, right? Staphylococcus aureus, subspecies Anorbius, and Staphylococcus saccharolyticus, right? So these two bacteria, what they show? They show catalase negative, and they are anaerobic. That's a point that you should notice, right? That Staphylococcus aureus subspecies and orbeus and Staphylococcus saccharolyticus. Both are what? They are catalase negative as like to the Streptococcus, and they are anaerobic, right? Now talking about the virulence, how the virulencity of these particular things come means, obviously if that is the bacteria, it will obviously show some what? Infection, and will tentatively produce some clinical signs and pathogenicity, right? So how these Staphylococcus are going to produce some pathogenicity or clinical signs? So what are the several reasons this particular bacteria is producing some clinical signs or manifesting somewhat pathogenicity? So very first reason is what? The capsule that is there on the Staphylococcus, right? Second is the coagulase. So what does the coagulase do? It will convert the fibrinogen to the fibrin. If you are going to just perform a coagulase test on a plasma, on a rabbit plasma, what it will do, it will just convert the fibrinogen to the fibrin, right? And that fibrin deposition after the conversion, how it is going to help the Staphylococcus? If there will be a coating of the fibrin after the conversion of the fibrinogen to the fibrin, right? So what it will do, it will be just making a shield around this Staphylococcus bacteria from the what? Phagocytic cells that are there inside your body, right? So that's how the coagulase help in the virulence factor of the Staphylococcus. Talking about the next, that is the teichoic acid that is present in the cell wall of the gram-positive. In every gram-positive, the teichoic acid plays an important role in the virulencity, right? Now there are several hemolytic toxins that are being produced by the Staphylococcus, and the main one are the alpha and beta. There are several more. The delta is also there, right? And there are several proteins also. Okay, so the protein A, what it is? It is a surface component which will bind to the Fc region of the immunoglobulin G, and it will inhibit the opsonization process. That's what the function of the protein A is, right? So the next is what? Your peptidoglycan. Okay, it is a layer that will obviously that will protect the bacteria from the phagocytic cells and all, from the what? Harsh environment also, right? Now the second, there are few enzymes also, which are what? Lipase and hyaluronidase, right? And there is also an enterotoxic shock syndrome toxins that are produced by the Staphylococcus. Okay, and there are several leukocidins also. What are leukocidins? These are the cytolytic destruction. They produce what? Cytolytic destruction of the phagocytic cells, right? Because there are several phagocytic cells that are there in the body, and what it will lead to? It will lead to the destruction of those phagocytic cells, right? So this was all about the what you'll say the virulence factor, right? And there is also a toxic shock syndrome toxins that are produced by the Staphylococcus. Okay, if I talk about the toxic shock syndrome toxins, which is what? TSST, which is what? Toxic shock syndrome toxins, right? So what's the function of these toxins are that what they will do, that they will just secrete, or they will just induce for the secretion of some chemical substances which are known as lymphokine, okay, which will lead to what? The damage of the tissues, right? So the lymphokine production due to these toxic shock syndrome toxins will lead to what? It will lead to the tissue damage, right? That what you should remember about the TSST, which is the toxic shock syndrome toxins, right? Now talking about this, that the coagulase production correlates with the pathogenicity, means the coagulase production is quite an important thing, because what coagulase is doing is, see, consider this as the bacteria, right? And if this is it is in what? In blood, right? So what it will do, it will secrete coagulase, right? After the secretion of the coagulase, what it will do, it will just produce what? It will convert the what? Fibrinogen to what? Fibrin, right? So this fibrin is going to just surround the Staphylococcus bacteria. After the conversion of the fibrin, this fibrin will be forming a shield around the Staphylococcus bacteria, which will obviously protect from the phagocytic cells. So that's what the function of the coagulase is there in the Staphylococcus. Okay, so there are conditions that are several bacteria will produce coagulase, several will not, and several show variability in the production of the coagulase. So if we talk about the Staph aureus subspecies aureus and Staph aureus pseudo-intermedius. Okay, both are what? Coagulase positive. So whenever you are going to perform a coagulase positive test, these two species of the staph will show a coagulase positive. While if we talk about the Staphylococcus hycus, it will show a variable reaction towards the coagulase test, right? And the your Staphylococcus epidermidis and Staphylococcus saprohyticus both show negative what? Coagulase test. Okay, so you should remember that which particular Staphylococcus is giving the coagulase positive, which is negative, and which particular species is variable. So the variability is also important, right? Now we are going to discuss about the diseases that is produced by the several species of the Staphylococcus into different hosts, right? And there are some diseases that are important in the perspective of the objective point of view in your, whether it is your PG examination or rather it could be your institutional examination that you are giving, right? So there, because in the objective we all know that the examiner will look for the peculiarity that is there in every genera of the bacteria, right? So in the Staphylococcus, see, if you are studying any bacteria, right, I had discussed that particular thing in one of my video, that how you are going to study the bacteriology, right? So you can just go and watch out that how you are, what approach you should follow to just study the bacteriology, right? So I won't be discussing because the video will be going to just be too long. Okay, so you can just watch out that particular lecture. Okay, so talking about the what diseases could be produced, so if we talk about the first species, which is the Staph aureus subspecies aureus, so in the cattle, sheep and goat, mastitis and the tick pymia that is produced in the lamb, it could be an objective. Okay, which particular bacteria is going to cause what? Tick pymia in the lambs. Okay, because it is caused in the early age of the lambs, right? So it is quite sensitive. The lambs are quite sensitive to this particular disease. So it could become in the objective that which of the following bacteria is going to cause what? Tick pymia. So the answer would be what? Staph aureus subspecies aureus. Okay, in poultry it will cause the bumblefoot. Please, it is important. That's what I had already highlighted that particular segment. Okay, so just note it down that which particular bacteria in which particular species is causing which particular disease. So that is important. Okay, so the tick pymia is caused by what? The Staph aureus subspecies aureus, and the bumblefoot is caused in the poultry by the Staph aureus subspecies aureus. Okay, it do cause what? Omphalitis in the chicks also, and the Botryomycosis is also produced in the case of the swine by the same bacteria, right? Now, talking about the Staph pseudo-intermedius, okay, so the Staphylococcus pseudo-intermedius in the dog will cause what? Pyoderma, means your dermis will be completed with the what? The pus, right? So when there would be a condition where the dermis of the dog is just surrounded by what? The pus, right? So you could just do what? Take a swab and just rub it around the lesion, or just rotate the swab around the lesion where the pus is there on the dermis. Okay, and when you are going to just perform a culture, okay, and you are going to form a pus culture for that particular pus, what you are going to find that it could be a Staph pseudo-intermedius. After several reaction, okay, several tests performing, you can just come to the specific species of the Staphylococcus. But to just know that whether it is a staph or not, you can just clearly form a pus culture to just diagnose, right? Now the next disease, which is the greasy pig disease, which is quite famous for the objective purpose. Okay, it is caused in the pig by the Staphylococcus, right? And what it causes, it is also known as what? Exudative epidermidis, right? That you should know that greasy pig disease is caused by which particular bacteria. It is a good question for the objectives, right? So it causes what? Exudative epidermidis, right? Now in the cattle, it causes mastitis. Now talking about the Staph aureus subspecies and aureus, so in the sheep it causes what? Lymphadenitis. Then in the dolphins also there is a Staph delphini, which causes a suppurative skin lesion. So what I could say in the general, that as they are the common commensal, the staph and the strepto are quite a common commensal in either in your nasal tract also, okay, in your nasal tract or the respiratory tract, these are common commensal, okay. So whenever the pathogen, whenever the body is going to be immunosuppressive, right, so these particular bacteria, what they do, they prevail the condition of the immunosuppression and will cause the disease, okay. So these are common commensal, okay. So in majority of the pus lesion you are going to find either the strepto or the staph, because in the pus lesion they are quite common. Okay, they are quite common in the pus lesion. Okay, so the staph and the strepto are famous for the suppurative lesions, right? So that you should know. Okay, if the examiner is asking in the viva also that which following you can just find out in the pus lesions, so you can just state that staph and strepto are quite common in the pus lesions, right? So there are suppurative lesion caused by the staph delphini. Now talking about in the dogs, there is an otitis externa that is caused by the staph chelicerae subspecies coagulans. Okay, and one more thing, when you are going to just have several differentiation, how you're going to differentiate the colonies of the staphylococcus. So the very first thing is that generally the staphylococcus colonies are what? White and opaque, right? And but in the some of the bovine and the human strain of the Staph aureus, what just it do? It will just form a golden yellow color colony. Okay, so if you are going to see a golden yellow colony, okay, so that's a peculiarity of the Staph aureus. Okay, that in the what, in the media, in the your general media, either in the BHI also, it will form what? It will form a golden yellow colonies. Okay, so it is a peculiarity and also an MCQ question also for the objective point of purpose, right? Now talking about on the sheep and the your bovine blood agar. Okay, so the blood agar, obviously it will contain the blood of what? In the cases of the sheep and the ox blood agar, so there are four particularly hemolytic toxin that are produced, which is the alpha hemolysin, beta hemolysin, delta, and the gamma hemolysin. So if I talk about the alpha hemolysin, so it will produce what? In the agar, it will produce a narrow zone of complete hemolysis. Means the RBC will be going to rupture in a quite a narrow zone on the blood agar, right? If we talk about the beta, it will produce a wider zone but of a incomplete hemolysis, right? And if we talk about the delta, it will form what? A slower complete hemolysis, while in the case of the gamma, it will produce no hemolysis, right? So the gamma is what? Non-hemolytic. Okay, and there are certain staphylococcus strain which are going to produce what? Both alpha and the beta. So this, they will produce what? The double zone of hemolysis. So this is an objective point and an important point, that which particular staph bacterial strain will produce a double zone of hemolysis, which are what? Staph aureus and what? Pseudo intermediates, because they are producing what? Because they are producing both alpha and the beta toxin. Okay, as they are producing the alpha and the beta toxin, and these two are on the strain that are going to produce those particular alpha and the beta toxin simultaneously. Okay, so these two strain are the only one. Okay, so it makes a much more of an importance that which particular bacteria is going to produce a double zone of hemolysis. So obviously it would be our Staph aureus and the pseudo intermediates. Why? Because both of them have a capability to just secrete what? Both the alpha and the beta hemolysin, right? So it is an objective point, right? Note it down, because in every new genus you are going to study, there are several important points for the objective purpose that you have to notice down, right? Because it's make you much more difficult to just remember that one day before for the objective purpose of the examination. So you just prepare a chart itself, right? So there are several questions that could be formed. So the double zone of hemolysis are formed by what? Your Staph aureus and the pseudo intermediates. Why? Because they are the only one who are going to produce what? Alpha and the beta toxin. Now there is one more thing, that there is a term which is known as hot cold lysis. So what does hot cold lysis is? So what happens when the beta hemolysis is done? Okay, when it is completed, if you are going to store that particular blood agar containing the beta hemolytic condition, okay, and you are going to store that at what? 4 to 15 degrees Celsius. What it will lead to? It will lead to a condition of complete hemolysis. Okay, there would be a complete hemolysis after storing the beta hemolytic partial completed, right? What beta is doing, it will be going to perform what? It will be producing a wider zone of partial hemolysis. But after further storing that particular blood agar at a temperature of 4 to 15 degrees Celsius, what it will lead to? It will lead to a complete zone of hemolysis. Okay, that is known as hot cold lysis. So it is also an objective point of view. So what is a hot cold lysis and how it is going to produce, at what temperature it is producing? So it is important. Okay, I am mentioning all the objective point, please notice. So this is an objective point, this is an objective point, that which are producing a double zone of hemolysis, right? And what is hot cold lysis? Which particular bacteria is producing the golden yellow colonies, right? Which bacteria is producing a condition known as greasy pig disease? Okay, which is bacteria is producing a bumblefoot condition or a tick pymia condition? These are objective, please notice them. Okay, now there is also a thing that you should know in this staph. What is that? How you are going to differentiate between the Staph aureus and the Staph pseudo-intermediates, because both are producing the alpha and the beta toxin. So that is where the mannitol salt agar or MSA agar plays a role. So notice one thing, this is an all important MCQ point also, that which particular media is used for the Staphylococcus. So it is what? Mannitol salt agar. So what's the composition of this particular mannitol salt agar is that it is containing a bromocresol purple, which is a pH indicator, right? So a bromocresol purple is contained in the mannitol salt agar, which is a pH indicator. Along with that, there is a 7 to 10% of the NaCl or the sodium chloride, right? Now, how these Staph aureus and the pseudo-intermediates is going to be differentiated? So they are going to be differentiated by what? See, what happened? The Staph aureus is going to utilize what? The mannitol, okay? And it will lead to what? After the consumption of the maltose as a nutrient, okay? So the Staph aureus will be going to produce some acid. It will lead to what? A drop in the pH. Obviously, the acidic pH is low, right? So for that purpose, we had already having a pH indicator in our MSA agar, which is what? A bromocresol purple. So that particular bromocresol purple will be going to change the color from the purple to the yellow, which can't be done by the pseudo-intermediates. Means the pseudo-intermediates is unable to utilize the mannitol, right? If this particular bacteria is obviously not utilizing the mannitol, so it can't change the pH of the agar, ultimately can't change the what? The color from purple to yellow. So that's how you can just differentiate between the Staph aureus and the Staph pseudo-intermediates, right? Now there is one thing also, that the presence of the 7.5 to 10% of the NaCl, it make it much more differential between the gram positive and the negative, because it make it selective for the gram positive bacteria, right? That you should remember. Now what we are going to talk about is the alpha toxin, which is the major toxin in the gangrenous mastitis. The beta toxin, sphingomyelinase, is there, right? There are certain toxins that are also produced, right? Alpha toxin, it is major toxin in the gangrenous mastitis. A beta toxin, what it is? It is a sphingomyelinase, which will damage the cell membrane of the host cell, right? The toxic shock syndrome that I had told you earlier also, that it will produce a chemical substance known as lymphokine, which will damage the tissue, right? Now there are certain diseases that we are about to discuss regarding the what? Staphylococcus, right? So the very first disease that we should discuss about is what? Your bovine staphylococcal mastitis. Okay, so there are generally two forms. First of all, by what bacteria it is caused? It is caused by the Staph aureus or Species aureus. Okay, so there are two particular forms of this particular bovine staphylococcal mastitis, which is what? A periacute and a gangrenous form. Okay, so obviously in the early age, if this particular disease is there, it is quite fatal, okay? Because in the gangrenous mastitis, this particular condition, what it will lead to? It will lead to the cold blue black coloration of what? Your quarters, right? It is quite bad for the production of the milk, right? Because in that particular segment, what in the gangrenous mastitis, it is affecting the quarter, which is having a cold and blue black color. right? Means it will be quite cold when you are going to just touch the teat of the animal. It will feel what? A cold, right? It will lead to the tissue necrosis, which is attributed to what? It is attributed to the alpha toxin, okay, which will lead to what? It will cause the contraction and the necrosis of the smooth muscles that are there in the walls of the alveoli of the mammary gland, right? So this is what you should focus on. Now moving to the important, which is the tick biemia. It is famous for the objective. Remember this particular segment. Okay, so talking about the tick biemia, it is caused by what? Staph aureus, subspecies aureus. Same in the case of the lambs. Okay. So first of all, if we talk that this particular disease is generally transmitted by what? There is a tick which is known as the Ixodes resinus, right? So this is what an common habitant which help in the transmission of this particular disease. How so? See, I have told you that these bacteria are what? A common commensals on the skin, on the respiratory tract, right? So this particular Ixodes resinus is quite common carrier for the rickettsias, right? So whenever it is going to come on the surface of the lamb, what it will do, it will just make a lesion, right? It will make a lesion on the surface of the what? Lamb, right? After there is a formation of the lesion on the surface of the lamb, so consider it as a lesion. Okay, so what is happening? So these are the staphylococcal bacteria, so it will just directly enter through the lesion, right? And there will be a systemic spread of the Staph aureus, right? So that's how the Ixodes resinus is helping for the transmission of the Staph aureus in the cases of the lamb, which will lead to a condition of a tick biemia. Talking about the greasy pig disease, which is also known as what? Exudative epidermatitis, right? So this is also having the same thing is there. Okay, so the pig that are there of the below the 3 month of the age are quite susceptible for this particular disease, and it is caused by what? Staphylococcus, right? So there will be excessive sebaceous secretion in this particular disease, and non-pruritic dermatitis is seen in this particular disease, which is the greasy pig disease, right? Now the fourth one is your Bacteriomycosis, which is caused by the Staph aureus itself. It is seen in the cases of the saw, right? So the infection, it is of an infection of the spermatic cords and the mammary gland. So these four diseases that we had discussed about the Staphylococcus, they are not of that much importance for the your descriptive point of view in the examination, but they can come in the objectives, right? Likewise, the tick biemia and the greasy pig disease can come in the objectives, but not in the, I would say, it won't be coming in the descriptive answers. The examiner won't be asking you to write in a note on the tick biemia until and unless he or she will be short of diseases to ask you, right? Because they are not of that much importance of the descriptive answer, because there are several diseases like anthrax, brucellosis, your black quarter, strangle gland. There are several diseases to ask for in the descriptive answer. So they are important for the objective point of view. Now there are two strains of the Staphylococcus aureus that are currently of the famous. Likewise, there are methicillin resistant Staph aureus and vancomycin resistant Staph aureus. So what happened? Due to the regular usage of the antimicrobials on the, what are the antimicrobials that kills the bacteria? In the simple standing, you just understand it like that, because in the next year in the pharmacology you will be studying the antimicrobials. So if I talk about that, what are the methicillin resistant Staph aureus and vancomycin Staph aureus resistant Staph aureus? So what happens that due to the regular usage of the antibiotics, right? So methicillin and the vancomycin are nothing but antibiotics, right? So if there would be an excessive usage of the antibiotics on the bacteria, so what they are going to do, they are going to make a change in their structural configuration in order to just resist any affection towards the antibiotics, right? So that's why there are two strains, that is the methicillin resistant Staph aureus and the vancomycin resistant Staph aureus, which are known as MRSA and the VRSA, right? So it is owing what? It is owing a different virulent gene which encode for what? Different virulent factors, right? So that was all about the Staphylococcus aureus and its strain, right? So here what I close for the Staphylococcus. So that was all the important things that I could just told you about the Staphylococcus. So for the objective point, what? Tick-Pymia, greasy pig disease are important for the objective point, right? The mannitol salt agar, what the constitution of the mannitol salt agar is important, and what's the purpose of the mannitol salt agar is, and for what bacteria like Staphylococcus are grown on what? The mannitol salt agar, right? These are objective. Now the double zone of hemolysis is an objective. Hot cold lysis is an objective. The golden yellow color of the Staphylococcus aureus is an objective, right? So these were all about the Staphylococcus.